Cryptococcus. Now, Cryptococcus is an opportunistic fungus, meaning that if it finds the opportunity, it can kill you. Seriously. Now, it causes the disease cryptococcus. Now, the organism which we'll study that is causing cryptococcus is C. Cryptococcus Neoformatum. Now, Neoformatum meaning it is a formidable fungus. Now, this formidable fungus exists in the form of yeast. Now, our normal fungus, some are dimorphic, meaning that outside the body it exists in the form of mold, whereas when it enters inside the body, it forms into a yeast. This is the form of hyphae. It can acquire a specific shape when it turns into a yeast. So now this mold is grown at specific temperatures, like it can be 20 degrees, it can be 40 degrees, but in the body when it is in the form of yeast, it is grown approximately at 37 degrees centigrade. But some organisms like Cryptococcus are actually not dimorphic, meaning that it can either exist in the form of mold or in the form of yeast, but this organism exists in the form of yeast. It has a specific shape. Now this specific shape is it looks like an oval cell which has a narrow budding, and it is encapsulated or covered by a polysaccharide capsule. Now this organism, where it is grown, it is normally seen in the soil which is heavily contaminated by bird pooping. Now, meaning a lot of bird pooping will actually help this organism to grow, especially pigeons. Pigeons really know their things. Apart from that, Cryptococcus also has another genus which is known as Cryptococcus gardii. Now, the Cryptococcus gardii is grown on eucalyptus trees, so meaning that our koala bears are mortally affected by this. Now, what happens now? This bird pooped infected soil, when it ever gets into the air, it turns into this yeast is carried with it and it enters the body. Now when it enters the body, it causes serious life-threatening disease. I was telling you, it is C. Neoformans. Now C. Neoformans is your formidable enemy that can kill you, but if you have AIDS. So it is only life-threatening to those people who have AIDS, meaning that they have reduced cell immunity. This is reduced cell immunity is also seen in old people and new people which are infants, but this is more life-threatening for those AIDS patients. Now in those AIDS patients, it can lead to serious complications such as meningitis. You would think that it is not very dangerous, but their immunity is already a potato, so meaning that they don't have any sort of immunity, so it is much severe in them, and it can also cause subcutaneous nodules in their skin. The most severe manifestation is if this AIDS patient is taking HAART. Now what is HAART? HAART is in order to overcome the AIDS or its complications. At least it is highly active retroviral treatment. Now, if you get this fungus along with when the AIDS patient is treated with HAART therapy, this results in a serious manifestation which is known as iris. Now, iris seems a lot beautiful, but it is actually not. It is actually immune reconstruction inflammatory syndrome, in which you are killing your own body because of increased formation of CD4 cells, which are natural killer cells that worsen the inflammation inside the body. So if you're having a normal patient meningitis, imagine it 100 times worse. So how do you diagnose it? We take a specimen from the AIDS patients, from the meninges or whatever tissue that it is infected. Normally we're not going to take a brain tissue, obviously, because that will kill the patient. So we do a spinal tap and we take the spinal fluid, but the special type of dye in which we see this organism is the India ink. See, India ink. Now in this eye you'll see the hyphae growing. which will have a small, narrow budded appearance with a capsular, with the polysaccharide capsule. Now, this only under a microscope can be seen by a specific type of stains which are known as the methamine stain, periodic adhesive, or mucicarmine. So it's quite special. Now, upon culture, we can see the similar colonies, which we already know, the small beaded, narrow beaded appearance. And on serology, we can see its antigen, capsular antigen. Upon latex agglutination test, it becomes so popular that it's given its special name, which is known as cryptococcal antigen test, or short for Craig or Craig. Okay, so what's next? How do we treat it? In AIDS patient, we have to combine the treatment. We give the patient amphotericin B with flucytosine. Now, flucytosine helps to penetrate the blood-brain barrier more, meaning that it can enter the CNS a lot well in case of meningitis. And in patient of AIDS, after giving such a treatment, we need to give the patient a lot of fluconazole for a long period of time, because their immunity, they do not have an immunity, even if the remnants can cause such dangerous effects if they are left inside the body. And if the patient has a kidney disease, we need to replace the amphotericin